All right, welcome back. Thank you so much for staying with us. It's Thursday, that means we are talking matters health. It's January, that is Cervical Cancer Awareness Month, and that is the conversation you're having today. Cervical cancer, what is it? What should you know about cervical cancer? And with me in studio I have Josiah Mwandaza, that is a reproductive health specialist at Marie Stopes Kenya. Quite interesting, he'll be telling us more about Marie Stopes. But it is important to know that cervical cancer is one of the most common cancer affecting women, yet is also one of the most preventable. And sadly, many women lose their lives to this simply because, you know, they were never informed, never screened or encouraged to take action early. Karibu sana, Happy New Year.
Happy New Year. Thanks for having me. All
right, now that we are talking about awareness, January being Cervical Cancer Awareness Month, let's just start from that particular point. What is cervical cancer?
Thanks for having me. My name is Josiah Mwandaza, working for Marie Stopes International Kenya, a non-governmental organization working in over 37 country programs. Here in Kenya, we operate in almost every part of the country with at least 16 facilities. They are spread all over the country. We take lead in offering quality assured services, mostly the RH services, to include maternity services, the general health, like any other facility that you know of. But just to mention, we are located in Nairobi mostly, with Eastleigh, Kilimani, Runda, the Kenyatta Market facility, Pangani, etc., etc. In the outskirts, we have Nyeri, Nakuru, Kisumu, Mombasa, and the Eldoret town as well.
So you're saying you offer also maternity services. Does that mean that you also help women give birth? You have midwives at Marie Stopes?
Yes, just like any other hospital setup, we do offer maternity services with gynecological checks and reviews and the entire treatment. Yes, at our Eastleigh branch, right?
We've seen, you know, the conversations around Marie Stopes, of course, online. But what do you think people quite don't understand about Marie Stopes?
A lot of people do not understand what we stand for. I think it's important to clarify that. So Marie Stopes is a non-governmental organization. We take lead in all the RH services and all the other general health services, to include lab services, the pharmaceutical services as well. I know we are known for family planning generally and the post-abortal care as per the Constitution of Kenya. But we also take lead in treating any other general ailments like any other health setup in the country. Yes.
All right. Now, before we get into the point of how you address cases like cervical cancer, now it's of course associated with that area, the woman area.
Yes.
Then how would you describe cervical cancer to our viewer this morning?
Thanks. I will say cervical cancer is a disease that is caused by a virus called the human papilloma virus, the HPV. There are many strains that can cause cancer, but I'll be very specific to the cervical cancer. And the specific strain is type 16 and type 18. So what happens is basically there is need to have persistence with the infection at the cervix for it now to cause the abnormal cells. So the beauty is that once a person has been infected with the HPV type 16 or type 18, it takes 8 to 10 years for them now to develop what we call precancerous stage or lesions. This is to say they still do not have cancer, but if left unattended, that can now again and now develop into what we call the cancer. So from the time of infection to when a woman will now develop now the cancer, it may take now 10 to 15 years if all is healthy. But again, we need to take note of people whose immunity has been compromised. The transition can be very fast. To be precise, it can now take 5 to 10 years with someone whose immune system has been compromised. So allow me to give at least some figures about Kenya, because this is a public health burden. According to the KDHS, the Kenya Demographics Health Survey of 2022, in the country, nearly between 5,200 to 5,500 people normally get newly infected with the HPV virus. The sad truth is that yearly again, around 3,200 to 3,500 do die following that disease. As a matter of fact, 9.1% of the general population as we speak do harbor this virus HPV. Yes.
What do you think makes it such a significant public health concern? It comes, in Kenya, it comes second leading cause of cancer-related deaths after breast cancer. But would you say that cervical cancer is a silent killer?
Thanks for that. Indeed, it is a silent killer. And maybe just to elaborate further on that, it becomes a burden. Why? Because it takes a lot of time now for the infected person to develop the disease and show signs and symptoms. So within the precancerous stage, this person may show no symptom at all. So the problem with us as human beings, we only seek medical services whenever we feel there is change from the normal. So I think it is important for every woman who is sexual active to seek screening, basically to check now and again. To be precise, it is important for any woman at their 20s or their 30s who are already sexual active now to start the testing, because it is through the testing that we are going to detect the abnormal changes, which is now the precancerous stage. Early detection would mean proper diagnosis and again elimination of the disease before it now starts to develop into cancer and again spread to other tissues or other organs.
I see we are rushing a little bit, but I want us to take this step by step for the benefit of our workers. This is like a class we're learning.
Yes.
Give us, an explanation of the cervix practically.
Yes.
Because, when we're talking about cervix, others might confuse it. We have the uterus, we have, of course, the vaginal area.
Yes.
But when talking about now the cervix being affected and it having a cancerous, virus, then what is the cervix exactly? Where is it?
So the cervix is part of the entire reproductive health system. And let me start by saying there is the birth canal. So between the birth canal and the uterus, there is a gate. So the gate is what we call now the cervix. That is, in other terms, we refer to it as the neck of the womb. Yes. So that is the part where us as medics, we normally make jokes and say it is the most honest part of the human female body. Why? Because it opens, that is, it gives way now for menses or for the menstruation period. And again, it may give way when intercourse, so that maybe the spermatozoa can swim through. But primarily it gives way now for the delivery of the baby. But all these times it is normally closed. When women are doing their general cleaning, there is a soft part that someone may feel inside the birth canal that feels like the nose, with slightly maybe like a hole that is closed. So that soft part that someone touches when they're cleaning themselves in the birth canal, that connects the birth canal to the uterus, that is the uterus, that is the cervix, sorry.
All right. So when that particular area is affected, of course you said it's just closer to the womb, then is the womb also affected just by the fact that the cervix is affected?
Cervical cancer develops in stages, as Ali mentioned. So first, there will be changes at the cervix because the tissues of the cervix is made of, cells. So there are two cells that, interchange. So where they meet, we call that the squamocolumnar junction. So that is the area where now the HPV virus now, likes to thrive. there will be now changes from normal to abnormal in regards to the cells. And with time, 8 to 10 years, they become precancerous. Precancerous means this person still doesn't have cancer, but it is like a message. When we detect early, we know this is a positive lesion that can be dealt with early if it detected early enough. But if not now, the abnormal cells continue to grow. They grow and later transition to what we now call cancer. Then again, it will now spread to the other tissues and organs, to include now the uterus. Yes.
We were getting a bit into the causes of course, cervical cancer, and we mentioned the HPV virus. But
yes.
Is it strictly the only cause of cervical cancer?
Primarily, that is the cause. But again, we have predisposing factors. So for example, women who start their sexual debut early enough, and maybe women with multiple sexual partners, they increase their risk of, contracting the HPV virus. People who smoke, again, they reduce the ability of the natural immune system to function properly. People who are obese, again, it is recorded, and I'll be very sincere, that use of oral contraceptive, the mechanism is not well understood. Again, people with many children, we call them multiparous. Those are the predisposing factors that can, put a woman at risk of now developing or rather contracting the HPV. So once you contract the HPV virus, the good thing is that within the first 1 to 2 years, the HPV virus can clear by itself because the body system will start to fight it. And again, it's important to note that every person who is sexually active at some point, they may contract the HPV virus, but the beauty is within 1 to 2 years, it will clear off by itself. But persistent infection with the HPV at the cervical canal, now it will now predispose the woman now to develop into what I call the precancerous stage, then later to cancer.
So when you talk about oral contraceptives, and we know, I'll assume these are, consist of the birth control.
The pills, generally.
The pills.
Yeah.
Then what is the safer option? And when you talk about the pills, the one that we know about and, the public inaongelea sana, that is P2. I don't know your take on P2. That is what we know here.
Yes.
But which ones are the safer option that now would not predispose a woman to cervical cancer?
Yeah, I didn't say P2 is a predisposing
it's an example.
factor. I know you called it an example of the oral contraceptive. But again, let me clarify that, because P2 is not a method of family planning. It is used as an emergency contraceptive. So what I talked about the oral pills is basically the commonly known chagolangu, that is the microgynon, the 21 pill, or the 28. I say the science behind it is not well understood, but it has been put as one of the predisposing factors to cervical cancer. I believe it is based on the consistency and persistence use of the pill. Why? Because it is important to understand the reproductive health goal of a woman. If they will need to have a child in the next 5-10 years, there are other methods that are long-term enough to serve the woman. So the clinical staff is normally advised or rather informed by the reproductive health goal of the woman.
You talked about the types of HPV that are there. You mentioned we have 16 and 18.
And 18.
But are these the ones that we have in Kenya, or it just cuts across even globally?
Yeah, those are the ones primarily causing cervical cancer, but we have more than 40 genotypes of viruses that cause the genital tract cancers. But primarily the ones that cause cervical cancer is strain type 16 and type 18. Yes.
So what are the risk factors that contribute to HPV, aside from just the sexual intercourse?
Yeah, I talked about starting sexual debut early enough. I talked about smoking. I talked about multiparity, where a woman gives birth to many children. I talked about obesity. So these predisposing factors, they are not the causes. But once you have these factors, they increase the risk of you now having HPV transition to precancerous and again to cancer. And as I mentioned, by the age of 50, most of us who are sexually active by the age of 50, we may have contracted the HPV without knowing, but good enough, our immune system fought that out within the first 1 to 2 years.
You also addressed the current state of cervical cancer in the country. You said it's a current health burden in the country.
Yes.
But talk to us about the current state of HPV vaccination in the country, the coverage levels, age, who gets it, and any challenges uptake as to the uptake of HPV vaccine.
Yeah, thanks. I will talk about that in threefold because we have what we call primary prevention. We now have what we call secondary prevention, then tertiary. With the primary prevention, basically it's about creating awareness to the people, educating the community, and ensuring that they do understand the need now for vaccination. So talking about vaccination, there are several types of approved vaccines. Here in Kenya, I know there was a debate back then, and I would like to demystify that, that these vaccines will not put our women and men not to reproduce in the future. But basically, they will protect the generation going forward from now maybe developing cervical cancer. So 5 to 6 vaccines have been approved by the WHO, and they cover more than maybe 6 to 7 strains. So it is very important that we target the age population that has not yet started sexual intercourse. And mostly we talk about the below 14s. Basically, after 9 years to 14 years, both men and women, basically boys and girls, are the best target population. But that said, we still have the other types of vaccines that are supposed to cover the older generation. And in terms of the administration of these vaccines, we do have the 2-dose schedule within 1 year, or maybe we have the 3-dose schedule within a year. So, but that is informed by the age bracket of the client. But precisely, we do advocate for the generation, or rather the age set that hasn't started sexual intercourse, mostly 9 to 14 years.
So what are the limitations of this approach? If you're starting it at 9 to 14 years, I don't know if schools are taking this up, but what are the limitations? Yeah,
that's why I said the burden is orchestrated by social factors, environmental factors, and economic factors. Like you, who is educated, informed, and again, earning a living, you are more empowered to understand this and go for these tests. There's someone who is living in the village, she or he is not privy to this information, and maybe they're not in a position to go. So economically, there is also a cost that comes with it. But I would like to commend what the government is doing alongside the World Health Organization. There was a strategy to, eliminate, to reduce these cases, if not eliminating them. And there was a rule that was introduced. If I remember very well, we used to call it the 90-70-90 rule, whereby 90% of the population is made aware that there is cervical cancer and the need for vaccination to enhance prevention. And then 70% of the population gets screened. And I will talk about how do we now detect this virus. Kindly remind me how we test it so that the public can be aware. So 90, I talked about vaccination, at least 90%. I talked about 70% screening. And then the aim is to have 90% of those who have been screened, those that will have been screened and turned positive, to be treated.
So when you're talking about the age of about 9 to 14 years, these are girls who are
still in school.
Still in school, have not yet made
primary,
coital debut. That these are social colonization, and when you talk about introducing viral-like particles then form antibodies, then how long do they remain in the system to protect one from, the virus, from getting HPV? Because I assume a girl at the age of 9 would need that kind of protection even as they go into their reproductive years.
Yeah, that's a valid question. I believe the body has its own way of eliminating any drug that comes into the system. However, like the other vaccines, there are some vaccines that do confer immunity once you get them. And again, there are some vaccines that will protect you for quite a period of time. So these vaccines that are mostly the ones that we do give to the young girls and boys. Let us not forget the boys in here, 9 to 14 years. Basically, it is meant to protect them before they do start their sexual debut. After they do start, it will still confer protection to these people. However, we still recommend that the moment they do start the sexual activities, we do have a schedule for them now to still come for the screening and testing. So it is not like a proof that once you are vaccinated against HPV, you're not supposed to undergo the screening or testing. It will still be important that those who will still have been vaccinated, they still get an opportunity to go for the screening and testing. But of course, the protection is meant to cover them as they grow.
So for women, the vaccination, these are young girls, of course, 9 years to about 14 years. But you mentioned the men, the boys as well. What's the age that they're vaccinated?
Same age, 9 to 14, believing that majority of these young people, this young generation won't have started before the age of 14. Yeah, so both the boy child, the girl child, the injection is basically given intramuscular, the deltoid muscle, just at the arm, to schedule now for the 9 to 14 years.
All right.
Yeah.
So there's this notion that there's no routine HPV tests, for men, and that in turn means that a lot of men have HPV unknowingly. Is that really correct?
There's what we call myths and misconception, and I would like to address that. But first of all, allow me to talk about part of the things that we recommend for men. It is true that men can transport the virus from one place to the other. And I would like to say the use of the barrier method, which is now the condom, to be precise, it doesn't completely protect the man from, getting the HPV. What it does, it significantly reduces the chances of them contracting. But again, now that we are not covered fully and it's a virus, the uncovered areas, the man can still pick the virus and transfer or carry to their partners. That is to say, we are all not proof. And it is important that men and women do understand the proper usage of the condom, even though it doesn't completely protect them. So having said that, it is important that both men and women go for screening, but this changes. Why? Because for us, men, we do not have the cervix, but we have, the manhood. So for women, there are several screening tests that we normally do. Number one, we do what we call VIA, that is visual inspection with acetic acid. These are basically now the commonly found screening approaches that we have in the country. So VIA basically uses the table vinegar, very cheap, and it is at the discretion of the clinical staff now to check, see, and interpret the findings. So this one is subjective to whoever is doing it based on the experience that they do have. But again, it is important because once they notice something that is not normal, it is better for them now to go to the next course of action. Apart from the via screening, we also do what I call the HPV testing itself. We are now going for the virus itself, and we do now the HPV DNA testing, whereby it is just blood, then taken to the lab, etc., etc. On top of that, we still have what we call cytology. Cytology now are the things like pap smear. I know you've heard about pap smear. So this is a test where we scoop some cells from the cervix through the birth canal, and they're taken to the lab and now for interpretation. So once these results are out, now they tell us what we're supposed to be doing. But precisely for the screening, it is basically we are going to know whether there are positive lesions. Positive lesions, I take you back to the 8 to 10 years after acquiring the infection. It is still not cancer, but there are some lesions, there's some growth that will tell the clinical staff that this person needs treatment to eradicate these abnormal cells before now they convert to cancer.
All right.
Pap smear, again, it will tell us whether the person has cancer, and again, at what stage. The same with the other HPV testing. So the form of treatment will be informed by the stage of the disease.
So let's go back to that point where, you know, a man has been tested and has been found by HPV, and of course he has a wife at home or anything. Then is it recommended for them to totally abstain from engaging in coitus, or is there something that you help them with just to prevent the spread of the virus, maybe to the woman, now that, say, the man has it, and there's this conversation that goes online that says men are carriers of, you know, the HPV, now they give it to the women?
What is needed is basically for all men, including myself, we embrace the screening and testing. Fortunately for us, allow me to use that word, what we can normally go through is maybe have another strain called the prostate cancer. By the way, I said breast cancer is the most common, followed by cervical cancer in that order. Then prostate, then esophageal in that order. So for us, what we get is basically, it's an HPV, but not basically type 16 and 18 for us now to say we will develop cervical cancer, but we develop a prostate cancer, which is one among the 40 genotypes that I talked about. So for us, even our testing, and I would like to make it clear, it is basically what we call PSA. We do check PSA levels, and it's basically blood for men, and I will really urge the public, any man above 40 years, it is important to go for that test. Alternatively, in poor resource setup, based on the level of experience of the provider, well trained, they can do the digital examination now. Digital basically go through the rectum to see whether there are any abnormal growth. I know it may be uncomfortable for the men, but if that is what is available, it is better to use what is available and again detect these changes early enough for possible eradication and elimination. So for the issue about men being carriers, there is a possibility. I go somewhere, I contract the HPV, whether I used protection or not. If not well cleaned, again, there's a higher chance that I can as well take it to the other side. So just like HIV, it is important we maintain cleanliness, because this is a virus. You have done the act. Clean yourself. It is not complete to say once you clean yourself, the virus is off the hook. The answer is still no. But what I would urge the public is proper prevention methods, proper detection through the screening and testing, so that together we can reduce this public burden that we have.
So in short, you're saying HPV cannot go away. Even if vaccination is done, they find you're having a treatment cannot entirely, eradicate HPV virus.
The point is, it is important for us to vaccinate. once we vaccinate that age that hasn't started the sexual debut, there's a higher chance that they may never develop. They may never, if they contract the HPV, it will not now develop to the precancerous and again maybe to cancer. But for those of us who have not been vaccinated, the chance remains high for us to contract the virus, and again based on the immune system, how it will respond. I said it earlier that it can be cleared by itself within the first 1 to 2 years. But again, based on the immune system, with the same persistent infection for years, it will now start to develop into the precancerous and again to the cancer stage. Yes.
So educate us on misinformation as you continue to talk about myths and of course misconceptions around cervical cancer. And I saw a tweet that said that there isn't enough evidence to show effectiveness of HPV vaccine in reducing cervical cancer, and that sometimes it could cause permanent disabilities. How true is that?
For me, that I will treat that as a myth. Why? Because the vaccine is not supposed to bring about morbidity and suffering. Basically, the vaccine is here to protect us once we get this virus, not now to transition to the other stages as Ali mentioned. So I believe that it's not a matter of burdening the woman with this vaccine so that they do suffer, but instead we are protecting the women from the pain and suffering that is caused by the HPV virus.
So how does cervical cancer present itself? And I'm asking this with regard to the pain factor. Most women say there's no pain, they don't experience any discomfort until something happens later on in life, and then they're tested and they find this cancerous cells. Then how does cervical cancer present itself?
Yeah, I said it is a silent disease, and that is why the public burden that comes with it, because people will not notice that there are changes in their body unless screening or testing is done. Having said that, there are two cardinal, let me call them signs and symptoms, and basically it depends with the stage of the disease. But mostly those who are infected and they have developed now cancer, cervical cancer, there will be an abnormal pervaginal discharge, and it could be watery or foul smelling. Then number two, there will be pervaginal bleeding that is unexplained and even in between periods. There are also some other signs and symptoms to include pelvic pain or pressure, but all this will depend with the stage, and for them to be more pronounced, mostly it will be during the late stages of the disease. I know when I said painful intercourse or pelvic pain or pressure or in between bleeding between one's menses or periods, and again the vaginal discharge, then people are already assessing themselves. So I want to tell the public that there are some other sexually transmitted infections that could present with the same signs and symptoms. So why wait? Whenever you have bleeding post-intercourse, whenever you're feeling you're having discharge that is not normal, the pelvic pain, pressure, ladies, do not wait. This is the right time for you to visit any other facility. And like I said, as Mary stops during this month of cervical cancer awareness, I want to tell the public that as Mary stops, that is an NGO, we decided to waive the consultation fees in regards to cervical cancer questions. And again, the testing for pap smear, we have waived that fee. We have reduced it from 4,000 for pap smear to now 2,000. We will still do free consultation in regard to cervical cancer, but for HPV DNA testing in all our outlets, it stands at 12,000. And again, that is why it is a public burden, because it can be detected early, it can be eliminated early, but if not, now the cost will be higher to manage that disease.
We're told that sometimes pap smear, which of course has been touted as quite prominent and important when it comes to cervical cancer,
Yes.
that can only detect these asymptomatic signs, of cervical cancer. But now the question, and you'll correct me if I'm wrong on that, they say that, when the symptoms are there, then pap smear won't be able to entirely detect any, chances of cervical cancer.
Yeah, that's a good question, and I said it depends with the stage, and again, where the test was done, because when we do a pap smear, it gives more classified information, basically on the stage. So that is why we say CIN1, CIN2, those are the terms that as medics do use. But again, there could be some truth in it. Why? Because whoever did the interpretation, if they give results that will not inform the other end for the cause of management or treatment, then that can be missed. And I must say that depending on where these tests were done, it is very true that sometimes people do take a step of faith to go and conduct the screening or the testing, then they are given wrong results. So it is important now that we need to have a series of checks, preferably 3 to 5 years. But for those who are HIV positive and they are sexual active, we do recommend them to have these tests done every year, because the period in which the transition takes place from precancerous to cancer depends with how the immune system of the client is at. Yes.
So we can agree that, when we talk about pap smear, then this is a service that is, the people that are financially privileged, financially capable, are the only ones who are, privileged to have pap smear. Then how do we handle the fact that pap smear can't go to, the people in the villages, the people who are financially underprivileged? And these people who don't get this pap smear are the people who also get, cervical cancer the most.
Precisely.
Then how do we handle the fact that...
Yeah, again, I would like to really give a thumbs up to the government, because all these services that are found in the private facilities, they are equally available in the public setup. We are the same doctors, we are the same nurses, we are the same clinicians, so to speak. So I would like to urge the public that these services are readily available in the public facilities. And as a matter of fact, it is the government that gets into the entire burden of taking care of its population. So I urge the people who are listening, tell a friend that it is important not to miss the chance of having screened or having tested. And I said, there is the first approach where trained and competence-assessed providers can do the visual inspection with acetic acid. And I believe table vinegar goes for not more than 80 shillings. And that one bottle can serve as many people as possible. And I'm sure whoever is trained, they'll pick and interpret the results correctly. And maybe for continuum of care, refer the clients for further management. But again, I believe based on the stage of the disease, it's not about treating and letting go, but it's not about testing and letting go, but it is testing and treating. And these equipments are readily available in the government facilities as well.
Now, something that I know the public would love to know is the treatment options that are available for invasive cervical cancer. Walk us through that.
Allow me to start with the other stage, which is the precancerous, because that is now the most important stage. I said, if someone is infected today, based on their immune system, they can take 8 to 10 years before they develop the precancerous lesions. So whether it was done through the screening via the visual inspection with acetic acid, or the HPV testing, or the pap smear, these positive lesions, luckily, they can be managed through either cold heat or extreme temperatures. Cold heat, we normally do what I call cryotherapy, where we subject these abnormal cells on the cervix with very low temperatures and freeze By freezing them, we will be causing destruction to all these abnormal cells, and then eliminate and stop the transition to now a cancer. If not the cold temperatures, we can use extreme temperatures, and we call that thermal ablation. I want to tell the public that this is available both in public and private facilities. There are some other things that we do based on how big the lesion is. Sometimes the lesion is bigger enough. We cannot use a probe or rather a small disc to freeze. And I will not talk about them, but we have LEAP where we do electrosurgical execution. We remove, or do what we call the cold knife excision. But that aside, if the disease has now manifested itself and it has now spread to other tissues or organs, and then other forms of treatment like chemotherapy, radiation, surgery that is normally done in bigger facilities, both in private and public, will now take center stage. But I'd like to tell the public that it is not the end of everything. Even if the disease is at its late stage, there's still what we call palliative care, that to help those who are infected alleviate pain and suffering through palliative care. And all these services, again, they are really available in both private and public.
Great. So when you talk about surgery for cervical cancer, that part, when the cervix is removed during surgery, is the woman still at risk of cervical cancer?
It depends on the spread and how well it was detected. Sometimes we may remove the entire uterus, the cervix. Sometimes we may remove a portion, basically the area that has been affected. Yes.
This conversation online, we're talking about cervical cancer being caused, by the virus HPV, which of course is sexually transmitted. But there's this notion online that in the 90s, families are polygamous. There weren't cases of cervical cancer. Then is it something that is just coming up, or are we just being more open about, cervical cancer and that it has been there for years?
I believe it was all about awareness, identification and treatment. I would like to say where I come from, for example, in Kilifi, we still have problems of awareness, leave alone cervical cancer, and allow me to give examples of things like kidney problems, the prostate cancer for men. It is always associated with witchcraft. So unless someone understands, has the knowledge, has the know-how, and then they are tested or screened, that notion that these diseases are associated with witchcraft will still remain. So it is on the same breath that back then, maybe we were not that developed enough in early 90s. We are still a developing country, and that is why we still have even some public and again some private facilities that do not have these facilities to offer these important services. So it's all about awareness back then, and we did not have maybe the capacity to detect early enough and again treat. But it's not like this disease was discovered just recently. It has been there, and I believe our brothers from either east or west, they were doing a lot of things back then. They were doing a lot of research back then already,
And I know that the World Health Organization is aiming at eliminating cervical cancer by 2030. 2030 is just 6 years away. Are we in the right strides to eliminating cervical cancer?
I will say yes, we are doing something, but I cannot say we are on the right path. Why? Because largely the population, majority, they're still not aware. Majority have not yet screened, and that is why the Vision 2030, I talked about the 90-70-90 rule. I must say we still have a lot to do as a country to ensure that we educate the public as early as 9 years, all the way to menopause, where people can no longer, the women can no longer maybe give birth. That this is a conversation that we need to have at any given point in time, whether you're sexually active or not. Because the more we are informed, the more people will go for screening and testing, the more people will have this disease detected early enough before it now transforms to cancer.
So as we wind up this conversation, Josiah, what message would you give, every woman or girl watching us this morning, and they're hearing that this month is Cervical Cancer Awareness Month? You talked about the signs, the symptoms, the treatment options, but how should we now protect ourselves against cervical cancer?
I will say the better protection will be identification, because all of us, as long as we remain sexually active, we are at risk of contracting this HPV virus. Good enough is 1 to 2 years, it may be cleared off the system by the natural immunity. But while still 8 to 10 years, you do not have an opportunity to go and have a screening test or a test even once, then we're not doing justice to ourselves. The best thing we can do as individuals, it is remaining accountable for our own health by taking up the initiative to go and test. But all the same, we need to spread the message that cervical cancer remains a silent disease, and the more silent we remain, the more the disease will remain a burden to the country and the world at large. So I would like to urge everyone who is listening, everyone who is watching us during this cervical month awareness campaigns, please take a moment and visit any facility of your choice. I said Maristops, we are waiving some fees for the pap smear. So kindly take that opportunity to visit any Maristops facility. And allow me to give our toll-free number. Maybe they still have a lot of questions. They want to talk to the clinical staff.
Right.
So our toll-free number remains 0800 72 0005. So that is our toll-free number. You can always reach out to us as Maristops, 0800 72 0005, and you'll talk to us and you'll be referred to any facility of your choice.
All right. Offering reproductive health solutions countrywide.
Yeah, we remain Maristops. We take lead in reproductive health services. I remain Josiah Mandaza.
All right. Thank you so much, Josiah, for making time for us this morning to educate us more about cervical cancer, even as we mark Cervical Cancer Awareness Month. Once again, this is preventable. HPV vaccination is being championed for. But a question that, the last question now. Will that vaccine still take effect if it's given at an older age? Say 40 is not old, but yes. Say at an age of 40 plus. Exactly,
yes. The answer is yes. And that is why we have specific types of vaccines for the specific age to cover specific strains. I hope you and your friend and the other friends will take a moment of faith and visit a health facility for screening and testing. Looking forward.
All right, that is Josiah Mandaza, reproductive health specialist at the Maristops Kenya, and that brings us to the end of this conversation. Once again, just to emphasize, January is Cervical Cancer Awareness Month. Let's all go for screening and, of course, vaccination from the HPV vaccine. My name is Anne Odida. Good morning.